Have you ever had a thought that was so upsetting, so terrifying, so distressing that your first instinct was to just push it out of your mind and stop thinking about it as quickly as possible? Maybe it was a thought about something terrible happening to someone you love, like an accident, some sort of health diagnosis, a failure that you feel you couldn't recover from. And maybe no matter how many times you've tried to push that thought away, it just keeps coming back. That's what we're going to talk about in today's video. We're going to talk about a very counterintuitive but surprisingly effective way of dealing with these types of scary future-based worries that keeps looping in people's minds. What we're talking about in today's video are a certain type of worries. These aren't your basic, I have a test tomorrow that I haven't studied for kind of worry. These are what we call type 2 worries. Worries about the future, worries about things that haven't happened, things that may never happen. But these are worries that feel very real and emotionally charged. Like the idea of getting a life altering diagnosis, or the thought of your partner leaving you, or losing your job and everything that comes with that. These types of worries hit at our core fears, our deepest sense of vulnerability. And that's part of the reason why they're so distressing and so powerful. And what most people try to do when these types of worries show up is that they try to avoid them, mentally turn away, distract themselves, try and push these thoughts out of their minds. And at first glance, that makes a lot of sense. These thoughts are upsetting, they're painful, they're distressing to think about. They trigger a lot of fear and anxiety. So, why would you want to sit with that voluntarily? But the thing is, the very act of trying not to think about these worries is what's often what keeps them coming back. It's something we call the paradox of thought suppression. The more you try not to think about something, the more you actually end up thinking about it. Um, One of the things I like to do with my clients as I'm explaining this is to do what I call the pink elephant experiment. And so what I do is I ask a person to, for 1 minute, think about anything they want to think about. They can think about anything, their plans for the weekend, doesn't matter. But whatever they do in that 1 minute, what I encourage them to do and what I instruct them to do is to try not to think about a pink elephant. You can think about anything that you want, just not a pink elephant. But if you happen to think about a pink elephant, I ask them to make a mark on a piece of paper. So what ends up happening is they start that 1 minute and they're doing fine for the first few seconds, and then there's a mark on the paper. And then they go back and they're thinking about something else or seemingly thinking about something else, then another mark on the paper. And what ends up happening is over that course of the minute, they end up thinking about the pink elephant a lot, a surprisingly high number of times. It's because the moment you try not to think about the pink elephant, suddenly it's the one thing that you can't stop thinking about. And this is what happens in type 2 worries. If you're constantly trying to push these worries out of your mind and you're constantly trying to suppress these thoughts, all that happens is they just keep bouncing back again and again and again. And every time the worry returns, it feels just as scary and just as distressing, if not more so, because you don't allow yourself to really look at the worry head on. So that brings us to the question, if trying to avoid these types of thoughts and worries doesn't work, what does? Well, and the answer is something that feels totally unnatural, totally counterintuitive, but it's something we call cognitive exposure. And what cognitive exposure does is it's the opposite of what happens in avoidance. Instead of trying not to think about the worry, the idea is to actually bring the worry to mind on purpose and doing that over and over and over and over again until the emotional intensity of that worry starts to fade. So, in order to explain how this works, I like to imagine that you're watching a horror movie. Well, actually, you're watching TV. And as you're watching TV, there's this weird satellite glitch. And what ends up happening is the show that you're watching suddenly disappears. And what ends up showing on the TV screen is this horror film. Really awful, distressing, terrible horror film. So, what you do is you turn off the TV and get away from it. It's like, "Oh, this is really awful." But the next time you turn on the TV, the same thing happens. You're watching your show and this really graphic, horrific horror movie comes on and you turn it off. Happens again, and it just keeps happening. Now imagine what would happen if you didn't turn off the TV, if you forced yourself to watch that horror movie from beginning to end. Well, you probably feel really awful. It'd probably be really distressing watching this horror movie. You don't really know what's happening, and it's just each time something gruesome happens, you get even more and more distressed. But then you force yourself to watch the horror movie a second time, and the same thing probably happens. Maybe you're even more anxious about it because you kind of know what horrible things are going to start happening. But then you force yourself to watch this movie again and again and again and again. Think about what would happen to your emotional reaction the more you watch this horror movie. By the 100th time you've watched this horror movie, it's probably not going to be as scary anymore. It's like, okay, yeah, I know the guy starts stabbing the person with the knife. You've seen it before. You've seen it so many times that it's drained the emotion out of the movie. Now, the movie hasn't changed one bit since the first time you watched it, but what's changed is your emotional reaction to it. And that's sort of what happens with cognitive exposure. You replay the worry over and over and over again on purpose, not as a way of ruminating or catastrophizing about the worry, but to focus on the worry so much that you gradually drain the fear and emotion out of it. So let's imagine that my core fear is getting cancer. Now, instead of pushing the thought away every time it shows up, cognitive exposure would involve writing a detailed script of everything I would imagine could happen if I got diagnosed with cancer. And not just surface level stuff like I'll get sick, but step by step, detailed, what you would see, what you would feel, what other people would say, how it would unfold in vivid, sensory, emotional, graphic detail. And then the idea is I read that script out loud over and over again, slowly, deliberately, trying to picture it, focusing on it, at least 10 to 15 times in one sitting. With each time I'm reading it, I then, when I get to the end, I provide a rating of how distressing or upsetting it was to read the script that one time. And then once I make my rating, I read the script again, rate how distressing I was. And I do this again, those 10 or 15 times in that one sitting. And what will happen over time is you'll usually notice that the number and the rating goes down. Not right away, but gradually over time. Over time within the sitting, when I'm doing it that 10 to 15 times, but over time from day to day. What will happen is that rating will get lower and lower over time. Because by doing the cognitive exposure, what you're doing is you're teaching your brain that it can tolerate this worry, that you can sit with that image or fear and nothing catastrophic happens just by thinking about it. You're no longer reacting to that worry like it's a catastrophe or an emergency. Now, this doesn't mean that you do cognitive exposure for every single type 2 worry. It's a pretty heavy tool. And so the idea is you use it for those big, sticky, recurring, distressing type 2 worries that just won't go away. The ones that keep popping up no matter how hard you're trying to avoid them. Now, it's also important to understand the difference between this cognitive exposure and regular worry. With worrying, what's happening is you're usually jumping from thought to thought, playing out scenarios, trying to control the uncontrollable. With cognitive exposure, what you're doing is you're not trying to figure out anything to solve the problem. You're sitting with one clear imagined scenario and staying with it, focusing on it long enough for the emotion to pass away. So it's kind of like one of those old record players. What happens with worry is it's like the record keeps skipping and playing the same part of the worry over and over and over again. Whereas with cognitive exposure, you force yourself to listen to the song all the way from beginning to end, and then doing that again and again and again. The key is repetition. You're rewiring the emotional response to that worry through repeated exposure again and again and again. And look, to be honest, this process isn't pleasant. It can feel overwhelming. It can bring up a lot of distress. It can feel wrong. But the more you do it, the more you see that these thoughts, in and of themselves, are just thoughts. They're not predictions, they're not premonitions, they're just mental images that lose their grip over time as you do this cognitive exposure. I liken it a lot to those old Buckley's cough syrup commercial a few years ago where the tagline was, "It tastes awful, but it works." It's kind of the same with this cognitive exposure. It's really awful, it's really hard to do, but it works. So, if you've been working on tolerating uncertainty, if you're challenging your worry beliefs, and you're still finding yourself stuck in these looping, intrusive type 2 worries, you may want to consider cognitive exposure. Starting with one worry, writing out a worry script in graphic detail, and then setting aside some time where you won't be interrupted, where you can do the process of the cognitive exposure, reading through it over and over and over again, and doing that process even if it's uncomfortable, especially if it's uncomfortable, because that's where change happens. It's not easy. It's not easy to practice, but it's a tool that can really shift your relationship with these worry thoughts that can affect a person so much. And when those thoughts finally lose their emotional grip, what you'll find is you don't need to avoid them anymore because they just don't cause that much distress anymore. You don't feel them the same way. And if you're not suppressing them as much, they're not going to come up as much. And if you're interested in watching the next video in our series on worry management, I'll put a link to it here once it's been posted. So that's all for today's video. As always, thank you for making it all the way to the end of this video, and I will see you in the next one.